Welcome to Module 7. In this module, we are going to apply what we've learned about disability inclusion in health to the context of working in emergencies. In this first presentation, we will be talking about emergencies more generally, and in the second presentation, we will be focusing on disability inclusion in the current global health emergency of the COVID-19 pandemic. Let us begin by first thinking about what we mean by an emergency. In this case, we are using the WHO definition of an emergency as an event or incident that requires action, usually urgent and non-routine. So, by definition, emergencies often require us to take actions that are not normally part of our practice and to do so very quickly. When we are under this kind of pressure, it is easy to forget about the specific needs of certain populations, such as people with disability. We hope that by completing this module and the rest of the toolkit, you will be prepared with the knowledge and skills to be disability inclusive when the time comes to respond to an emergency. Let's think in more detail about some of the characteristics of an emergency. Emergencies may be due to natural hazards, for example, earthquakes, cyclones, floods, or droughts, or emergencies may be due to other types of events, including epidemic or pandemic diseases, major transport accidents, chemical or other toxic hazards, food insecurity, or conflict. Large-scale emergencies are considered disasters and result in serious and widespread disruption to communities. Emergencies often occur in countries or settings where health service provision is already constrained due to a lack of resources. During emergencies, infrastructure may be damaged, health personnel may be sick or injured themselves or caring for family members, and resources are stretched even further. This means that there are often very limited resources available to take actions that ensure healthcare is disability inclusive. For this reason, preparedness and embedding disability inclusive practices into everyday healthcare delivery is key, so that when an emergency occurs, it is simply a core part of how we work. People with disability are often excluded from the planning and delivery of health services and information during emergencies. However, having access to health information and health services is their right, just like everybody else. In fact, this is specifically addressed in the UN Convention on the Rights of Persons with Disabilities in Article 11. This article states that people with disabilities have the right to access health and other basic services, including water and sanitation, housing and settlement during emergencies. Let us consider why it is so important that our health responses are inclusive of people with disability during emergencies. Firstly, as we've just learned, people with disability have the right to access health services during emergencies. As health workers, our job is to care for the health of our community, and this includes people with disability who are particularly vulnerable during emergencies. People with disability are at higher risk of death, violence, and abuse during emergencies than people without disability. They may face a disruption to their usual supports or services, including access to medications, which could adversely affect health. They may also have lost essential assistive technology or devices when forced to evacuate. This can seriously reduce their independence and contribute to greater impairment. Emergencies may also result in people with disability being separated from their family or carers, increasing their vulnerability to abuse, isolation, or neglect. We know that during emergencies, the number of people with disability in a community can grow. This may be due to injuries, illness, or existing health conditions left untreated for long periods of time. Many injuries sustained during emergencies are left untreated or are poorly treated and without access to rehabilitation, which can result in a large number of people with severe and long-term impairments. However, despite the potentially greater need for healthcare, many of the existing barriers to health experienced by people with disability, for example, physical, attitudinal, communication, and financial barriers, are often exacerbated during emergencies. These factors contribute to increased need for healthcare, alongside an increased risk for being unable to access healthcare, which can have lasting consequences for the health and well-being of people with disability well beyond the context of the emergency. Now that we understand why disability inclusion is important during emergencies, it is also important to understand how and why this can be challenging. In the following slide, we will seek to identify strategies to address these challenges. People with disability have traditionally been excluded from the planning and delivery of emergency preparedness and response activities, including the planning and delivery of health services. People with disability are often not counted or identified during or after emergencies and are rarely consulted or represented in emergency risk management. The carers and families of people with disability may also lack knowledge and information about what they can do in emergency contexts to support people with disability. Consequently, the basic and specific needs of people with disability, including their need to access health, information and services, are often overlooked or ignored during an emergency. They are also more likely to receive less warning about emergencies and evacuation plans, and so are at higher risk of being left behind. So what can health workers do to be disability inclusive in emergency? There are a number of simple strategies that you can use during your planning and preparation for emergency responses to ensure that these are inclusive of people with disability. Engage people with disability or DPOs throughout the processes of planning, preparedness and response. DPOs can help to identify people with disability, where they are located and their needs, and will in most cases already be involved in providing support to people with disability during emergencies. They can work with health services to strengthen the planning and delivery of health services to people with disability before, during and after an emergency. Make sure evacuation and emergency response centres are physically accessible. Health service facilities may be damaged or may have collapsed, and in an emergency, health services may be provided from temporary structures. The physical layout and structure of such structures are often inaccessible. When there is flooding, landslides, mud, debris and damaged roads or footpaths, the terrain may become particularly difficult for people with disability to navigate. Therefore, health services should attempt to reach people by providing outreach health services. People with disability often do not receive early warning information about the onset of an emergency, evacuation procedures, or where and how to access essential services during an emergency. Ensuring health information before, during and after emergencies is provided in accessible formats such as sign language interpreters, large print, simple language or audio formats can help to improve awareness and uptake of these services by people with disability. Many health service providers have limited knowledge about how emergency situations affect people with disability or how to respond to the health needs of people with disability. It is therefore important to have disability inclusion as a core component of emergency preparedness training for all health workers. And finally, by including data on disability in health registers or health information systems, it will be possible to understand the needs and access to health services by people with disability during your response. This will assist in the planning and delivery of health services to people with disability for future emergencies. Now that you have a good understanding of the needs and challenges of disability-inclusive healthcare during emergencies, take some time to work through the activity in step 3 in the workbook to further consider how emergencies can impact people with disability.